And
All right, good morning, good afternoon, good evening to everyone that's joining us from the global EDS community. My name is Christy Cox, and I'm so happy that you could have this opportunity to join us today for a insightful webinar with a medical expert, Dr. Ralph Garbo, who's doing some really interesting research having to do with autonomic rehab. His background is he's a nationally recognized leader in autonomic rehabilitation and a real pioneer in treating disorders like dysautonomia and POTS. And he does that through an integrative neuro rehabilitation lens. He's a double board certified physician in both physical medicine and rehabilitation, PM&R, and then neuromuscular electrophysiology. So he has this really rare combination of clinical expertise, research, and patient-centered compassion. He's at the VCU School of Medicine, where he works with patients, and I was one of his patients when I lived in Richmond, Virginia. And he's going to talk about some of the tools that he recommends, including biofeedback and learning about heart rate variability or HRV training to do some neuromuscular reeducation. So he works a lot with people in the Ehlers-Danlos and EDS population, where, as you guys know, if you're joining us, that autonomic dysfunction is common, also misunderstood, and often misdiagnosed. We always get that, well, it's just anxiety. So Dr. Garbo is going to talk a little bit about that to us. So thank you, Dr. Garbo. Go ahead, take it away. Appreciate you being with us, and we look forward to hearing your expertise.
It's great to see you again. Thank you for having me on. I'm very grateful. And good morning and good afternoon to all of you. I'm going to start with the disclaimer to set expectations because for somebody who does research, other researchers don't. When somebody speaks passionately about something, they start to think that's not science. But if you're tight with your wording and the ground rules, I get passionate when I start talking about my science. Now, I don't live with this disorder, so I can have empathy, but I don't fully have the emotional context. But I do, and I don't promise outcomes, but this is what I do promise. I do promise a safe, evidence-based, universal starting point and a method to help you and I adapt together using a biomarker established for adaptability. So it's a universal starting point and a methodology, and have some spectacular outcomes and honestly strikeouts. And we don't know enough yet. And trying to tease through that, what are the what are the patterns there? So that's and we're doing a research. I have a method to improve adaptability with this biomarker. It's called the heart rate variability skills training for autonomic rehabilitation, HRV STAR. It's a 4 to 6 hour training program. Eventually, it'll be for anyone with a healthcare degree or anyone with an educational degree, and that then we would expand it, become a training center. And in 4 to 6 hours, you go to a primary care doctor, and maybe they're not familiar with the disorder, but maybe they can write a prescription for physical therapy and or psychology, and everybody's on the same page. with a physiology first. And so I'd like to say, if you've been top downing it, trying to think right, and you're trying to get the biochemistry right up here, let's try not necessarily better, but neglected approach of going bottom up first. Let's get I've had some amazing people come in and say, I'm doing fine. It's just my body feels stuck, like my body's anxious. And so we want to learn how to get at first the chest canister, I call it, and our health system is built for stiff old men, and we don't know what to do with people who have squishy vessels, who react differently to being stuck in persistent threat mode. And you'll almost never hear me say the word anxiety or stress. I talk about persistent threat mode, and it's bidirectional. Yes, if you're worried about your future occupation or your future health, that will have physiological effects. But if your body's stuck in threat mode, it will also amp up, and it's a chicken and the egg. But it is not fair to just toss it into the anxiety bucket, if you will. So I'm all about trying to get this treatment model scaled, and that's some of our research and the work we do, and Christy's familiar with it.
Yeah, so tell us a little, just, back up and give us your explanation of, the autonomic nervous system, as like your body's kind of autopilot with things like heart rate, digestion, and temperature, and things that you basically don't have any control over, and also you don't have to think about controlling.
Right. So, autonomic is like automatic. This is taking care of all your organ systems. And I always talk about a two lever system. We drive with one foot to keep it simple, but we are a high performance vehicle, and we have a gas and a brake. And what you have to learn about that is they're two independent levers. And a couple things. So this whole model is acceptance based. I get people to accept all the hard realities of physics and physiology, and then let's work from there. And so any counseling is in an energy based spoon theory, allostatic load, energy based model. So in modern life, the threat response is pushed down all the time with cell phones, etc. But your brain and body has a default threat mode. Your priority is to survive over thriving, and most people are seeing me. They're surviving and living in survival mode, but they're not thriving. And so, being stuck in persistent threat mode, physically and emotionally, and/or emotionally, has consequences because it's extremely powerful, but we always have to remember it's inefficient. And if you're stuck literally in second gear, and I'm driving around town shifting gears, and you're stuck in second, we don't look all that different, but over time, that's going to wear on the automobile. So it's being stuck. And the other thing you remember, the parasympathetic system, I don't think of it as relax and digest. I think of it as the recovery system. So you've just been chased by a lion for a few hours. Okay. Now we need to recover. And the parasympathetic recovery system is active. It's critically important that you think of it as a pit stop, not a garage. So recovery, and it's mostly at night. So at night, you should have mitochondria, the powerhouse of the cell, mitochondrial pit workers, lubing chassis, replacing tires, working very active to repair things. If you are sleeping a lot and still exhausted, that's a sign of post-exertional malaise. I'm sorry, non-restorative sleep. The people who have post-exertional malaise, that tells me they have a recovery capacity problem. And right now, a lot of people are looking at post-exertional malaise. I think the higher symptom is non-restorative sleep, and above that is this biomarker of how active your pit worker, mitochondrial repair, brain rinsing, all the stuff that happens at night. So sleep should be active and the sympathetic should be off. And that's what sleep should look like. But if you have hypermobile collagen, get a concussion, a viral illness, financial difficulties, the threat response could be stuck and the parasympathetic sleep recovery system could be gnarled. And your sleep could look like this when it should look like this. Hopefully that makes sense. And so this biomarker is essentially a marker of this. And the breathing practice does this. So we're working on this. And if many people are familiar with beta blockers will lift the threat response. The breathing practice will engage the parasympathetic. So we're trying to do both. I also believe acceptance therapy, right? One of the most beautiful things ever written was the Serenity Prayer for the 12-step program. It's trying to get you in the now, to not control the common things or trying to control the future or change the past. That will drive the sympathetic system. So this is speculation. I believe acceptance therapy does this. I believe beta blockers do this. And there are some muscle relaxers that do this as well. So I will try and help the person lift the throttle, and I'll ask them to start tracking skill one, and then skill two, a very specific breathing practice that is the definition of parasympathetic tone. So when it gets to the breathing practice, I get pretty particular, because I know what the science shows, and we can go over that. But that's the basic model, teaching the two levers and how we're going to work with whether it's and stop, shift, and decide. Stop, value recovery, understand it, track it. Shift, engage the braking system with the breathing, and then decide is some version of what decisions. If you recognize you're stuck in your thinking that's not helping you, well, how can we as help yourself? So if that is continuing the fight or flight response. So I consider our thoughts very powerful, and they do consume a lot of energy. And when you fight to think right, that will keep the fight or flight response going. So there's a difficult skill of letting go. So something like letting go of the future, letting go of the past. Easier said than done. A little bit easier after you engage the parasympathetic system. So there's a very specific order. You do this breathing technique, try and get parasympathetic, figure out what you need to let go. It's perfectly appropriate to worry about the future. That is perfectly valid. But the laws of physiology and physics will tell you that and beating yourself up about the past or being stuck on a interaction with a healthcare provider that went very poorly, and maybe you were judged, although valid, it costs energy. And I like to say we have energy. We need energy for the people we care about, the things we got to do. Try and engage in some kind of exercise program. And then the fourth one, your mitochondrial pit workers at night. And so if you're in a texting argument at 10 o'clock at night, I don't want you to take energy away from them, from your pit workers at night. That's how the psychology part of it works. But again, that's secondary. It's physiology first. And it's the diaphragm that increases heart rate. So as if you have a strong and rhythmic diaphragm, it will bring air and blood into the chest, speed it up. And as it relaxes, air and blood out. So it's not a chest breathing, it's a diaphragmatic breathing. I separate breathing timing and breathing strengthening. And let's set aside breathing strengthening and work on the timing. So if you do box breathing, with breath holds. You're doing both, but you're not really doing timing breathing very well. So it is absolutely not box breathing or 4-7-8 breathing. It is resonant frequency breathing. Resonance means harmony, oscillations, timing, rhythmicity. You've lost your rhythmicity. I will explain that how collagen comes to this. I don't say that that's the cause of your POTS, but I will say that overly flexible collagen, you don't recover spontaneously like other people. So if you've had a concussion or a viral infection that has set you back and people are spontaneously recovering in a natural time period, those you may remain stuck in persistent threat mode as the trigger. And so it's the same method, regardless of if it was a concussion, an emotional trauma, or a viral infection. So,
Let me pause you and ask a couple questions as we go along. You mentioned, you know, the first thing that you do is to learn to track. So what are the, tools or recommendations that you have people do to do that? And then secondly, share with us, some of this resonant frequency breathing and the breathing techniques that are the ways that you recommend.
okay. So, first of all, my fatigue questions, sleep questions go like this. If you tell me you snore, I'd like to get a home sleep study and make sure you don't have obstructive
Yes.
sleep apnea. There's low-hanging fruit there for improvement. Do you have a good circadian rhythm? Are your days days and your nights nights? The human being is built to have a regular circadian rhythm. It's super clear. You can have it inverted. You could work nights regularly and be awake during the days. That's not as hard on your health as an ever-changing circadian rhythm. So a circadian rhythm is essential. I need to know you value sleep. So all these devices that give you sleep scores, they're measuring sleep quantity. Heart rate variability only is important if you value sleep and have a decent circadian rhythm. So that's up front. Then I'll ask, do you have regularly a problem with sleep onset or maintenance? And what's the cause? Is it due to joint pains or racing thoughts or sweating too much? What's the cause why you can't get enough sleep? So we work on getting enough sleep and circadian rhythm. After that, this measure of the relationship between the heart and the diaphragm, that's heart rate variability. And I like to say, the more the diaphragm helps, heart rate will go down. You want your heart rate to go down, your blood pressure to go down, your temperature to go down at night. You want your HRV to go up. So I tell people somewhere along the line, your diaphragm forgot to do at night what it's supposed to do due to a software problem. So you need to practice the breathing twice a day and the second time just before sleep to get the diaphragm doing. But so this is a marker of the relationship between the heart and the diaphragm, which is also a loose relationship of what I call brain rinsing and mitochondrial activity at night for repair. So with heart rate variability, typically these are loose things. The higher the number, the more recovery. But trends matter. You cannot repair in one night. You will not be destroyed in one night. It is the persistence of this sympathetic tone that deteriorates things. So there's lots of good devices out there. There are a lot of wrist and finger devices with light sensors. Um, the, no one device is all that special at getting the data. It's how much they decide to track and how they present it. I'll say the Fitbit and the Aura make it easy. They don't hide the data. They don't try too hard. Garmin is great, but sometimes they hide the data and they call it body battery, and you don't get the actual raw data. I like teaching people about the raw data, but if you stick to one device, here are some rules. If you stick to one device, just tracking nighttime, not daytime, you don't compare to any other human. It's only trends against yourself. And it's trends, it's not one. So some of the tight rules is you look at the number each morning, your HRV or your body battery or some version of your readiness. Um, and maybe you learned something. Maybe you had a giant bowl of gluten soup the night before and your number's horrible, or you had 2 or 3 glasses of wine and your number's horrible. You can learn from that, but you don't spend more than 10 seconds on it. But let's say your average is 20 milliseconds, and that's a complicated number. But if you're below it 3 or more nights, I tell people you haven't done your mitochondrial housekeeping and your brain listening now for 3 nights. That is a not a day predictor. Like my number was good this morning, I'll have a good day. No, you'll be get very frustrated. But if you know ahead of time high risk days, that can avoid crashes. So skill one is avoiding crashes. So you do your gotta do's. Maybe you take your kids to school, you go to work, but that's not the day to sneak in extra physical activity. Maybe that is a restorative walk day, a recovery day. Do your hydrating, your salting, your patience, your kindness, your breathing. But the whole idea is to gradually sneak in activity without the big crash. I'm sure all of you have had crashes that last for weeks or more, and they can come in the form of sweating, they can come in the form of fatigue, orthostatic intolerance. They can take a headaches, they can come a wide variety. And if you have a heads up and you know today is a high risk day, you can make an adaptive decision. One of the things I typically tell people, the Levine protocol in astronauts is this beautiful program and amazingly healthy astronauts. They come back from outer space for 2 weeks of not fighting gravity. Their heart size is smaller, their muscles are smaller, and they have POTS. And they do fabulous laying down, biking, then sitting up, biking, and then standing up, biking. And they do fabulous. Something's happening with hypermobile collagen. And what you have to deal with, unfortunately, is it goes like this. Some people do get to the other side, they do spectacular, and they get interviewed, and it was amazing. But what you almost never hear is that the majority of people don't make it. So if you are in a standardized exercise program, okay, and you're not tracking recovery down here, and you haven't recovered from what you did 2 days ago, you're at risk for overtraining. So most of my patients are judged as undertriers when they're actually overtrying. And so we are individualizing this exercise program by knowing, and exercise is in quotes. It first starts with breathing and then maybe some light lower limb recumbent bike, but it's very patient because not crashing is number one. And you may have to delay a day or two in sneaking in the exercise program. So the real key, whether you use any of these devices, is a crash preventer, not a day predictor. And if you can gently start sneaking in activity every other day, might be every third or fourth at first, and it may only be 5 minutes with a recumbent bike or something like that. After you get used to the breathing, um, uh, that's that's how we can get success over months.
So just
Is
to clarify, I'm sorry to interrupt, just to clarify, a moment ago when you mentioned, people not making it, that's in reference to like they're not making it through the Levine protocol, right?
correct.
It's like that's not working for our body because it's this overdue and lack of recovery.
53% dropout rates. Yep.
Yeah.
Yeah, and there's other studies I could quote that were individualized home programs for chronic fatigue. And even though they're individualized, they're still dropping out. They're still overtraining um, until we have a metric. So in the sports world, athletic world, the Olympics are like there are hundreds of different ways to measure load tolerance. It's only in the last 10 or 15 years as we're now looking at this metric as recovery capacity. What's the size of your gas tank and how much are you filling it over the last 3 nights? So over time, we're trying to increase your gas tank or your battery, if you will, body battery. But if you haven't been filling it for 3 or more nights, well, expect more glitchiness of your autonomic software.
I like your analogy, of the car because it helps me understand both the on and off, but restore the battery because, a lot of us resonate with spoon theory and the idea of, like I only have a certain amount of energy. But for me, the battery theory makes a lot more sense because I have to recharge. And, if I don't, then I'm not going to perform well and I'm going to be like glitchy. And people easily understand that, like I would never go and leave my phone on 10% for the whole day because it would die. I mean, I get that intellectually. Why would I do that to my body?
Right, right. If you only have a half a tank and you're supposed to take a day trip, it'll take a full tank. It's good to know you only have a half a tank. And it does make things so. I have some people who struggle with delegating tasks just this week. And having that number allowed this person to say, okay, I'm going to do this ultra important thing, but because of this number, not because I'm weak or stupid or broken, I simply it's not worth the energy, and I'm going to have to delegate this task and ask you to do it. And the numbers help us uh, transition uh, away from everything being emotional. So this is a very energy based pacing concept. I like to break down pacing into energy restoration, and that is your nocturnal HRV. Energy modulation, that's learning how to shift your physiology real time out of sympathetic threat to parasympathetic recovery. And then it's energy allocation. What am I going to decide to spend my energy on? Is it going to be one of those four things? Or am I going to spend it on something I can't control or less healthy? And sometimes people have great joy in going to a concert and it fills their emotional bucket and they're jubilant. But what the HRV will tell you, that's good. You need to do the things that fill your emotional bucket, but they still cost energy. And so they'll have this joyous experience, but then they'll see their numbers tank. And then they'll have to decide, they'll have to recognize, okay, although I feel this joy, I'm wiped out. And maybe I can't handle 2 concerts in a week. Okay. So these are the energy decisions. But you do need to do the things that are core to who you are and figure out a way to get them done. Um, but they're not easy decisions.
Yeah, the fine art of pacing is and making decisions about what you do with your energy. Absolutely, that's hard. Um, Before I forget and lose track, can you share with us the practices that you recommend on the breathing to engage that diaphragm and get, like you mentioned, heart and diaphragm
Yep.
communicating, particularly before bed?
If any of you have had autonomic testing, the HRV response to deep breathing test is the test of the parasympathetic system. The test is laying down like you are asleep, putting your hand on the belly. If the hand goes up and down, that means you're breathing with the diaphragm, not the upper chest. Okay. And it's 5 seconds in, 5 seconds out. So the human most efficient, if you think of the diaphragm like a plunger, and the timing, it's 6 cycles per minute. So it's 5 seconds in, 5 seconds out. And then we look at how much your HRV, your heart rate varies, HRV, and that is the definition of parasympathetic tone. So 5 seconds in ish, 5 seconds ish out, no breath holds, no breath holds, no breath holds with proper diaphragmatic technique. 10 minutes twice a day for 6 weeks has been shown to improve nighttime HRV. So that to me is part of the universal starting point. Get your diaphragm doing what it's supposed to do to trigger these recovery, to lower your heart rate at night, to trigger hormonal repair. And it's safe, it's evidence-based. Now, many people will not handle that at first. They'll feel lightheaded. It's difficult. And the explanation here is critical. If you've been stuck for a very long time in persistent threat mode, when you do this breathing correctly, it is the most substantial hack, if you will, hack into the autonomic nervous system. And so it'll cause a pretty significant physiological shift. Your brain could misinterpret, this is my opinion, misinterpret change as threat when it's really parasympathetic. So, so don't try and do this on a bad day. Don't try and conquer this in one day. Gently engage with it. If you can't do 5 in, try 3 in, 3 out. Don't do breath holds. You want rhythmicity. You've lost rhythmicity. You want to lean into it a little bit and rewrite this software over weeks and months. Some people get it in a few days. Some people, it literally takes months. But if you want to feel peace and you want to feel parasympathetic, this is the route. So I like to say it's requisite, but you need to hear it's not urgent. If you try too hard, it'll be even worse. So, so I think it's a requisite skill to learn how to shift and become parasympathetic. Um, and it's healthy and it's requisite. Just don't make it urgent.
Pretty
And
fascinating. Tell us, you mentioned, like box breathing and 478. Are these, do you categorize those more into sort of like the like one time, use to try to get you to a particular state, and this other rhythmic one is more of a practice?
so fundamentally, breathing strengthening is important, and that eventually we can do other ways later. In this case, it's rhythmicity that's lost, and doing uh, box breathing is very helpful for very many people. But in this particular population, it's rhythmicity that I believe is the starting point. And everyone has a slightly different. So if you're doing this breathing, I encourage you to try and feel if you're more comfortable at 4.5 seconds in or 5.5 seconds. Everybody has a different resonant frequency. And when you are taking the time to mentally feel what's going on down here, that is called interoceptive, heart interoception. That habit and practice is very healthy. It's a foundation of mindfulness. So mindfulness is, several good things, but if that's not working for you, and I hear it all the time, I tried meditation, it doesn't work for me. So let's take a step back and let's just pick one of the 5 things that mindful meditation is good. And let's just look at the physiological shift. And now let's do this breathing, try and develop a habit, and let's do it with biofeedback equipment. So I strong believer of heart rate variability biofeedback. I'm less emphasis on EEG biofeedback. Heart rate variability is a much bigger electrical signal. It's a much bigger physiological shift. Let's do with biofeedback equipment. Let's teach you how to make this physiological shift. So one of the empowering things I can do with somebody who has panic attacks, coupled with all this autonomic, I can tell them when the chest cavity is in resonance, you cannot, and the words are very particular here, you cannot physiologically escalate a panic attack when you're in resonance. So you can at least halt the physiological feeling of a panic attack. Now, the second you stop, you could go right back to it. but it does give you a moment for self-talk or other people to help you talk, and for you to realize, although I was bitten by a dog as a child, this particular dog is behind a fence. And so if I can get the chest canister parasympathetic and put a pause, I then can start to see things and recognize, okay, this is a paper tiger, not a real tiger. And then I can let go of that. So it's physiology first, but it's it is a superpower uh, to be able to do that in the real world. And so I have them, breathing should be your default prior to a pill, prior to anything else. Breathing should your default. It will fail you. It will. It is just breathing. You may need propranolol or a beta blocker or something like that. That's fine. But breathing should be the default. And the other thing that can be a real game changer, I want to make sure I remember, when people have been in threat mode all the time, you may have a habit of breath holding. Why do we breath hold? The other test, autonomic test, is called the Valsalva maneuver. That's breath holding. What does that do? That increases your risk for passing out. What do power lifters do? They breath hold. That is very powerful, but they also are at risk of passing out. So as you stand up and you become lightheaded, you may not be getting enough oxygen to the brain, and you start to have all these symptoms. It might be a reflex of breath holding, which is a natural reflex to threat. Powerful, inefficient, high risk for syncope. I never tell anybody to take a breath because they may hold it. I want you to breathe through everything. You want the diaphragm to suck air and blood in, and you want it to push it out along with the heart. So you want to help the heart out with your diaphragm. And if I'm talking on a delicate topic and somebody starts breath holding, so that little rewrite can be massive for getting through a shower or getting through daily functions or emotional uh, Zoom meetings. Uh, and you're saving aliquots of energy, and maybe and fast heart rates are exhausting. And so the breathing could lower your heart rate. So let's say you have Zoom meetings that can be frustrating. You should do the breathing before and after. Lower your heart rate afterwards. Those 2, 3 hours of fast heart rates after a meeting, or just climbing the stairs, or having a meal, all those things trigger. You want to be good at lowering your heart rate. You may need helps with a beta blocker to get you in the ballpark, but you also want to be able to do it with your breathing and keep saving heartbeats and energy. All that tachycardia is exhausting. It's exhausting, and it's taking away from the important things.
Can you share with us a little bit about what you're doing with your research and what you're looking into and learning?
Sure. We just got so we have the HIV star, and then we have the HIV hero. We just got $6 million from the US military on multiple concussions, people, veterans and service members with multiple concussions, doing the heart rate variability biofeedback, and then tracking that long term with physiological metrics. There's two parts of the brain that are currently fascinating to me. One is the periaqueductal gray. I think of it as the vagal pressure sensor. And if you get stuck in persistent sympathetic activation and cerebral spinal fluid is no longer flowing, you can actually we believe, unproven, we believe that pumping with the diaphragm will create some movement and via the vagus nerve uh, uh, sort of help reset and get movement and realigning the vagus nerve. The other part that I think is part of the role in POTS, but the interesting part that I think specifically for EDS is this thin membrane that we've only known about for 10 years. It's called the SLIM, SLYM. That's the acronym. it is this 1 to 3 cell membrane that coats the brain. And underneath it is clean cerebrospinal fluid. And above it is the dirty filtered cerebrospinal fluid. So the way we rinse the brain, the diaphragm pumps, you get these waves of CSF, and then at night, it trickles through between cells, taking dirty things out of the cells. It takes multiple nights. So, brain rinsing, 90% of it's done at night or when you sleep, and it takes multiple nights. So, one night does not cure you. So, that's how the multiple concussions and things like that could, the concern is, will it lead to dementia and so forth. So this is brain rinsing. Diaphragmatic movement will help that. And then the dirty CSF, if you will, gets pushed out to this outer layer, and then hopefully it leaves via the lymphatics out through the neck. And yes, hypermobile necks are a role. All this stuff comes out of the head into a very narrow area. And so if you have hypermobile neck, it's real. Your postural symptoms, it's real. You have to hear it's real. Do we fully understand it? No, but it's real. But getting back to the slim, if this membrane that separates clean and dirty CSF is only 1 to 3 cells, what is holding all that together, that thin membrane? It's collagen. So again, I think people with hypermobile collagen, the concussion triggered the persistent sympathetic activation, but it's the collagen that kept you. 90% of people with concussions are improved in 2 to 3 months. But why is it I have patients with hypermobile collagen that linger, stuck in persistent sympathy? It's because you didn't spontaneously recover. So that's how I get people to think about the collagen and the role. And I'm fascinated by anyway. So the whole I believe that if you create it's a it's if it's a simple conceptually as if you can sneak in certain amount of exercise, which will strengthen diaphragms, which will get fluid movements, and you get quality sleep. So this, if you get better at these things for several weeks and months, repair happens. The brain and the body are these amazingly resilient and amazingly fragile. I continue to be amazed at how resilient the human body is. And then yet the most minor genetic defect or this slim layer gets altered. And obviously, if the slim layer is affected and you're mixing dirty and clean CSF, it's not a shocker that brain fog could be all part of, could be a part of your crash. Uh, so, so that's part, if you didn't do your brain rinsing for 3 nights in a row, your version of a crash could be cognitive fatigue. And I like the term cognitive fatigue better than brain fog, because if I can extract a history from somebody that at least they can be sharp under optimal conditions, your brain probably isn't damaged, but you're vulnerable to cognitive fatigue. And so cognitive fatigue, post-exertional malaise, chronic fatigue, non-restorative sleep, all those are fatigue symptoms. And so not tracking nocturnal HRV as a physician and scientist would be the starting point. So if I could hand you 3 months of decent sleep, that's what I would hand everybody. And that would be amazing. Well, at least let's make that the initial target. And how would we initially do that? Well, learn to track and learn to modulate.
And that can take a long, long time of practice, habituation, healing. I know in my personal instance, POTS at 150 beats per minute at rest. I was doing this like 10 minutes of the breath work, and like mindfulness, meditation, whatever like that practice several times a day. And it took me a couple of years, but it worked. And my regular heart rate, with a beta blocker, of course, is in the 50s now, which,
Nice.
yeah, but I mean, it's hard work, but like
And
it is one of the ways to really make an impact
and
beyond. Go ahead, sorry.
I'm sorry to interrupt. And context matters. So you got to understand. I can change one thing. I can say your home situation is unstable, and as a physician, we may not grasp that. But how are you possibly going to integrate all these things in an unstable home environment? So so context always matters and will obviously delay. Now, if you start if so if you have a safe place to sleep, right? If you don't have a safe place to sleep, how is breathing gonna uh, and tracking gonna change a person's life? So there are things that are just plain essential that we can't always know. Um,
Right. So I'll start, taking some questions here. One of them is, when you've been doing these things and you're still stuck. Megan is asking this question, and I'm not sure what, these things refers to.
I do. This is an excellent question. So resonance, harmony, coherence, oscillations, those are loose synonyms of each other. So, yes, this is coherence has a little different definition than resonance, but it's still timing and harmony. Um, Coherence is promoted by a company called HeartMath. I agree with much of what they say. I have one little distinction I like to say. There's no data to support replacing emotions. Like, I'm stuck in this emotion, I'm going to replace it with this. There's really no data for that. I do believe what they did significantly give us is that gratitude. So when I tell somebody to do the breathing, so this is a great question. I got 2 points about that. One, first get your chest canister parasympathetic. Now let's shift your emotion. Very clear. It is not your happy place. I won't talk to somebody with metastatic cancer about going to their happy place. I don't believe it's relaxation is the way to go. I don't believe it's remembering to be grateful up here and top downing it. I do believe being able to feel a shift physiologically. So I have them do the breathing with the diaphragm, shift into resonance, and then coherence adds in, instead of just the heart and the diaphragm together, now we're going to get the neurologic system. So now think of coherence as all three in harmony. And I do believe if you had metastatic cancer and you can find a way to be grateful to be with your granddaughter today, physiologically, you'll not only enjoy that time better, but I can make an argument that changing your HRV and your emotion is incrementally healthier. So I won't say that that changes your cancer outcomes, but I do think that's the route to why spirituality can improve cancer outcomes. So feeling grateful for small things instead of being stuck about all that implies with cancer. So that answer is yes. You asked about the Visible app. I do like that. That is an English product by someone who has long COVID. It's very practical. It does two things. It measures morning HRV, which is what athletes do, right? Perfectly healthy athlete. Morning HRV is okay and it's pragmatic. I like nocturnal HRV. I'm going to learn over time more and more. But if your resources are limited, it is a good pragmatic device with morning HRV. But where it really can help people, so Christy, when you are at 150 beats per minute, um, and you let's say you were plowing through it, this device would be an armband on your arm, and it would keep telling you, hey, you're too fast, and keep triggering you to pay attention. You're using a ton of energy now, and you may recognize it could have been emotional or physical, but you will make adaptive decisions. So I think it does a very nice job of cueing in people to how much tachycardia they really have. So they all have, all these devices have some advantages and disadvantages. Ultimately, I want a device, a medical device, where I can blind you of the garbage data. I have both the tracking and the biofeedback on one device. The data comes to me and my nurses. We can coach you from a distance. That's where we're going, but it's sadly right now, it's really messy. And so the HeartMath device for feeling grateful, that was the inner balance. For the COVID one, for being able to see the tachycardia, that's the Visible app. There's other apps. There's the Leaf product, which is a ECG on the chest, which will also give you haptic information triggering you that you're overdoing it. And there's, there's all kinds of devices. Again, I can't give you all the positives and negatives of each one because they keep changing.
Yeah, yeah. So I'm just looking through the questions and the comments on the chat, talking about people calming. Joanna says she's calmed her parasympathetic system as a second nature, like when she's driving to work, and that's been very useful. And how does that impact people, like myself and Joanna with really low heart rates? Um,
Yeah, the Whoop is also excellent. So the way that I favor the most simplistic ways that they can give the information. Sometimes these companies, Garmin and Whoop, uh, they're trying to appeal to the highest level athlete who may obsess on data. I don't want people obsessing on bad data. So half of what I do is keep telling people ignore that, ignore that, ignore that. Just avoid crashes and learn how to shift. And can you feel grateful at this meal? Feel. Underline the word feel. Physiologically grateful. Can you shift out of your future or past despair?
Yeah, which is a whole nother discussion about how to do that. I know that you're training with me of learning how to feel that physiological shift. Um, we're getting close to running out of time. I'm trying to Hannah Somatic's cat stretching routine. It's a mindful. Are you familiar with that?
So, so yes. So there's many ways to get us confused in healthcare. So the word interoception is paying attention to your body. The word exteroception is paying attention to the outside world. So you have five senses for the outside world. That's exteroception. Interoception or somatic therapy is learning to pay attention. I have over triers that plow through everything. They've been judged as under triers and they're plowing through everything. Learning to be interoceptive to various symptoms and paying attention and sitting with them is essential. What's the universal starting point in my mind? Let's do heart interoception first. And here's one of the exciting things just in the last few years. When you create this sinusoidal resonance in your heart rate, this rhythm that the biofeedback equipment, it's been shown to improve connectivity between your autonomic threat centers and the frontal lobes. The frontal lobes are who you want to be, where you want to go, and rather than just fighting or freezing your way through life. So I suspect you're living more in your frontal lobes now than you used to live in your autonomic centers. And this will improve, it's been shown in fMRI studies to improve connectivity. So let's get your chest canister to improve connectivity.
We're getting lots of great questions here as we're coming up on the hour, and I want to be respectful of your time. Petra's asking if like tight or weak breathing muscles should be addressed first, or do you think that like regular breathing exercise takes time to kind of regulate that?
I strongly believe addressing gentle rhythmicity prior to strengthening. Get comfortable with rhythmicity. I pull them apart and I prioritize rhythmicity first. We can get to the strengthening later. Um, and you got to get comfortable with being parasympathetic, and then later we'll work on strengthening.
Um, and then Eric is asking other webinars or trainings that you offer to clinicians to learn about more about these things.
Yeah, that's what we're trying to do with healthcare providers at VCU, Virginia Commonwealth University. In 4 to 6 hours, we're trying to train any physical therapist, LCSW, um, all kinds of that we're all on the same page and we're starting at the same place, and that you're getting the same theme because there's a lot here. It takes several visits. This is, it's not. This will be very confusing. There's no way to distill this in an hour, um, and
We're trying.
so so yes, that's exactly what we're trying to do. And we're trying to learn how to scale this.
So if someone was interested and local in Virginia or, wanted to learn about this online, where might we direct them to go to
Well,
do this training?
uh, it's I've done lots of podcasts. Um, the uh, the only social media I do is LinkedIn, and I do hashtag autonomic rehabilitation, and I'll post studies there. Um, but you can take the pieces of this and ask your physical therapist how to do diaphragmatic breathing. You want to do resonance, even if they want to talk you into box. And but and then you could follow in the athletic world, you could follow a guy named Marco Altini, but that's for athletes. Uh, so it's still messy, but there is hope.
Yeah. I'm so grateful for your time, Dr. Garbo. It sounds like we could easily do a follow-up to learn some more of this. I'm sorry we're not able to get to all the kind of specific questions, but again, being respectful of your time. Uh, any last comments you want to share with us before we sign off?
Um, just thank you for having me. Uh, it this is an invisible disorder. Uh, it's other people just can't see it, even healthcare providers. But I do believe in a few years, nocturnal HRV will be. When I just had somebody this week who's had long COVID, and they happened to have had this ring device, and they were tracking their nocturnal HRV, but they didn't know really what to look at. And we looked back at 5 years of data, and her numbers before she had COVID was, I think, 48 milliseconds. And the very next year, this is every night for a year. That is a ton of data. It went from 48 to 31. And now she's at 34. So it it's suddenly visually validating that this COVID infection in 2023 crushed her recovery capacity and was not able to work anymore. So it's not all cured, it's not all fixed, but it will be less invisible. And the COVID research will help you.
Fantastic. Thank you so much. Um,
Thank you.
Appreciate your time, your energy, all the work you're doing, and your research. Thank you, everybody, for joining. And I'll be sharing a recording of this through Zebra's Underground on Substack. And maybe I will be able to get some links from Dr. Garbo on some of the things that he's talked about and some of the research that he's doing. And again, thank you all. Good day, good night, good
Thank
afternoon.
you.
Take care. Dr. Garbo, I'll be in touch.
Thanks so much.
Thank you.
Thank you.
Take care.
Bye-bye.